Hi everybody, I have already made this video in the past, but goodness knows where it's gone. I've obviously posted it somewhere, but not on YouTube, so I can't reflect back on it. And I do see a lot of people with scars, either through surgery of the orthopaedic kind that is directly related to physiotherapy in terms of an MSK issue with physiotherapy, but I also see patients that have had scars through other surgeries as well, particularly skin cancer, whether that be melanoma or basal cell carcinoma or squamous cell carcinoma, and then you've also got caesareans as well, which we see some patients with too. So a recent caesarean scar. First and foremost, I am not affiliated with Weleda at all, but this is an amazing brand. It's got no crap in it. It smells absolutely amazing. My grandmamma used to use this, and it just reminds me of childhood for starters. But it's a fabulous thing to use on your scars. Actually, it's great to use on anything. And there's lots of different variations of it now, but this is just the very typical original skin food for dry and rough skin. So the texture is really thick and quite kind of gloopy. And what I'm going to do today is I'm going to talk a little bit about scar management, how to manage scars, why you should manage scars, and the different kind of scars you can get. So some of you may or may not know, but I've had an awful lot of surgery in the past. And it kind of continues. So I've had a lot of hip surgery, I've had a lot of abdominal surgery, and I've had a lot of surgery to remove tumours, and I have lots of biopsies for potential tumours as well. So I kind of stopped counting incisions when I got to about 38, and that was just for cancer. So I've got an awful lot of scars and probably quite a lot of scar tissue as well. However, this little dibbly-dobbly helps me to look after my scars an awful lot. So I'm going to show you the technique that I'm going to suggest you do on this one on my head. Now, it's not too bad really. I don't even notice it anymore. You know, now that I've pointed it out, you'll see it. But generally speaking, that's gone from being really horrible, nasty, ugly, 10 huge stitches on my forehead that I couldn't cover, swollen, and then it went scabby, and it looked awful, and I had eyebrows all over the place. As soon as that scar had healed, however, I started massaging it. Now, when I say healed, it needs to be sealed, yeah? So you've got no way of getting into the scar, so we've got no kind of opening, it's completely sealed, the skin is sealed. You might have a few scabby bits, that's fine, you'll probably find with massage they come off. And the technique that I use is just get the tinsiest bit of cream, yeah, kind of pull the skin fairly taut, and then you're just gonna really press quite hard and go in little circles from one side to the other, like really quite hard. And you're going to do this for a fair while really. I'd say a couple of minutes if you can stand it. And then just for the purposes of demonstration, I'm not going to do that today, not for a few minutes anyway. And then what you do at the end is you just smooth it. Yeah, so you just smooth that scar in the way that you would ideally want it to kind of lie. Because you will find that when a scar is new, it is red, it's angry, it's bumpy. As long as it's not weeping, you can get going with this. People will often say to me, but my scar feels a bit weird and it feels a bit funny. Yeah, I know, that's another reason why you need to do this, because the only way to desensitize a scar is to actually touch it. So a lot of people feel that because it feels so weird, they do the opposite. They don't touch it because it's like, it feels horrid. But the more you get sensation in that area, the more you touch it, then the more your brain understands what's going on, and it can start to kind of to sort itself out a little bit more as well. Scars come in different shapes and sizes. You'll have scar tissue, which basically is a lot of collagen fibre that'll go to the area, help the two sides to knit together and keep it all nice and sealed up, which is great. But collagen fibre is generally quite tough, and sometimes we need to break it down a little bit so that it doesn't turn into either a hypertrophic scar or a keloid scar, which is basically where you have too much scar tissue, and then in a keloid situation it kind of migrates off and it goes all over the shop as well. So you can end up with really quite angry looking scars like weeks and months and years later down the line. Certainly in terms of if you've had some quite major surgery, like a cesarean or any abdominal surgery, or you've had, I don't know, breast cancer surgery, so you've had a mastectomy, or you've had a lumpectomy, and you've got, or maybe you've had a node biopsy, so you might have some really quite juicy scars. What we really need to do with those ones, we need to make sure that you don't get scar tissue migration, tethering or cordon. Now, migration is basically where that scar tissue, those collagen fibres kind of flit off and they stick onto other things. Classic example, although it's fairly rare, it does happen, and I've seen it quite a bit actually throughout my time as a physio. When it comes to cesareans, sometimes those bits of scar tissue can migrate and adhere onto the bowel and the bladder and cause all sorts of complications. Time and time again, I say that patients are being discharged from hospital without any advice at all as to how to manage their scar. So you really need to start massaging it really quite quickly. As soon as it's sealed and there's nothing kind of gunky happening there, you need to do that a couple of times a day. You can use anything if you want. I just really like using this, and I think the proof's in the pudding. You know, my scars are pretty cool, really. They're not, I don't really have any nasty, angry ones. What can happen as well with scars is they can separate depending on whereabouts they are on the body. So I've got 2 on my shoulder, and I've got a huge one down my hip. So you often find that chest, shoulders, one on my chest actually looks like a gunshot wound now, although it was absolutely tiny, the scar originally. It was called a purse stitch scar. So instead of scarring it like cutting the incision like a line, so making the incision like the line, they kind of had a rugby ball, and then they kind of pulled it all up into a little gathered knot, basically. And then that's kind of separated. Now, I don't find that's a problem for me. It was really red and angry to start with, but again, with lots of massaging, that kind of fades, and then you just end up with a bit of white skin, basically. So it's no big deal. But sometimes scars separate, and that's not a bad thing. Don't worry about it. It doesn't really matter what it looks like in terms of the separation. It's not doing anything. You don't have to worry that it's going to split. But what we need to make sure is that that scar tissue doesn't migrate from the inside and doesn't start tethering onto things. When it comes to breast cancer as well, you know, quite often if you've had a lot of reconstructive surgery here, or if you've just had a lot removed, then you will have an awful lot of scar tissue, and sometimes that can become so tight it can literally bring your arm in, yeah, so that you really struggle to get full mobility through the shoulder because of all of the scar tissue. That can be prevented. There are always going to be cases where that happens, but it really can be prevented by the simplest of things. Just get friends with your scar as soon as you're able to, as soon as it's healed over. Few minutes, massage once, twice, 2-3 times a day if you can. Use something that you like using, and yeah, just try and prevent that from either becoming really angry, because lots of people are quite conscious about their scars. I'm not, don't really care. But more than anything, what I'm thinking of is the health and wellness of the fibres underneath, of your body underneath, to make sure that that doesn't turn into something that you need further surgery to correct, like a revision, cesarean scar, for example. So yes, I hope that helps. If you've got any questions, please fire them my way. I am happy to answer questions. But yeah, that's about it. Take care. Hope that was useful. Bye.